my name is Kelly Madrid. Today's date's November 17th, 2019, and this is week 3, lab 1, microscopy of microbiology, use and function. So I'm going to go over the microscope. So you can see, I have the microscope right here. So if you can see on top of here, this is the ocular lens. This is what we see everything through. Then you have the eye tube, which connects the ocular lens with the turret. The turret here, it's a knob, we call it a nose knob, that can help move the objective lenses to their certain focuses. So each objective lens has a percentage or a type of focuses. So the first one is 4x, then you go to this one, which is 10x, and then sorry, kind of disconnected it. And then this one is 40x, okay? And then right here, it's called the coarse focus knob, and then you can move this up and down. Kind of, you'll have your lens here, and you can kind of move it up and down to kind of focus it. And then you have this is the fine focus knob. So this actually, depending on which lens you are, focuses that lens to that object to see a clarification. You can kind of see blurriness, but that's why you focus it with this, okay? And then here you have your stage. Here is where you put your lens in, and then this is this lens clip. So it holds that lens in place, and then you can start adjusting it and moving it around, okay? Then, right here, as you can see I'm moving it, it moves up and down. That's called the transverse knob. So it helps move the slide to kind of guide you where you can find where the object's at. And then you have the, right here, this is the longitudinal knob. Kind of move the slides from side to side. Right here on this stage, I'm gonna kind of tip it a little bit. It's the condenser lens, okay? The condenser lens, underneath it, you have the diaphragm. This is right here. The diaphragm controls the amount of light that goes in through the condenser lens, okay? Down here, you have the illuminator. So when you turn it on, the light comes in. You can control it with the diaphragm, and then right here, there's where the condenser lens is. That's how you view everything, okay? And then this is the arm, and then this is the base of the microscope, okay? So with this lab, I have slides that have been prepped already, and kind of we had to view them through this microscope, and then kind of fill out the lab report that I have. So we had 6 total slides and a letter E, okay? So with these 6 slides and the letter E, I'll just put the slide in there, kind of show you how I do it. This is the first one. It's called the hole mount. Just kind of put it in there, and then you see how that holds the slide, and kind of move it around. Have my light on, move it around just to get a view, and then obviously I'll be looking through the lenses. So I did that with all 7 slides, and then described what the letter E looked like on the different magnifications, and the other 6 slides did what magnification sit best with each slide. All right, so that was part 1. Let me close this real quick. There we go. Put off this to the side. All right. So now I'm doing the wet mount swab. So what it is I will be getting a slide. I have 2 slides, okay? I will be getting a sterile swab, and then swabbing the inside of my cheek, and then scattering it on the slide right here. I'll get distilled water, and put 1 drop on top of that specimen that I'm going to collect from my cheek, and then get the cover slide and place it on top carefully, okay? As soon as I do that, I'll take it to the microscope and evaluate what I'm seeing, okay? Let me do that right now. Pull this in over. There we go. As long as it comes out sterile, I'm fine. Okay, so I'm gonna get 1 swab, put it inside my cheek and swab. Okay, then I'm gonna get my slide and scatter that all around, right there. Okay, now what I'm gonna do is place just 1 drop of distilled water. There we are. I'm gonna get my cover slide, kind of hold it upright first, and then slowly just drop it right there. So now what I'm gonna do I'm gonna put this in right here and evaluate, see what I see with my microscope, okay? And then I'll give my report on my lab report assistant, and then also with part 2, I'm gonna get another clean slide. I'm not gonna show you how to do it, just gonna explain, and then scrub on my teeth and gums and do the same process as I did with the cheek and evaluate what I see. Thank you.